the recording. Yes. Welcome everybody. Whichever part of the world you are, good morning, good afternoon, and good evening. Good night if you're from Australia or east of India. Today we have a doctor who's done over 325 seminars. I mean, I think this is the most anybody has ever done. 325 seminars. I mean, hats off to Dr. Rosario. He's basically an anatomy professor, and he's a principal director of the Disha Shikshan V Vikas Kendra's EB Gatkari Homeopathic Medical College and Hospital. He's attended many seminars in India and all over the world, and he's actually published 8 scientific papers in national and the international journals. And we are very happy to have Dr. Rosario with us, who's going to be doing this live webinar on the benefits of homeopathic remedies and prostatic ailments. Dr. Rosario, the mic is all yours. Dr. Rosario. Rosario, you can start. I'll get his slide in. And
Karthik.
Yes.
Hello, everybody. Here, yes. Can you hear me?
Yes, loud and clear. Loud and clear.
Am I audible now?
Yes, you are.
Okay. Am I audible? Take it to the.
Doctor, your voice keeps getting cut.
Okay.
Yeah.
Okay. Hello and welcome you all for we are going to deal benefits of homeopathic remedies, which is rather common patients we get, mostly prostatitis and benign pasia. That is why I have chosen this topic to share with you end of this session. Once, everybody has old age. I think to enter into the old age. In fact, old starts from which year is not universal. You get older and some get older at 50 or 50. Depends upon the constitution and because no demarcation of age. Okay, a person's old where actual retrogressive comments in your body and mind. So that is the mark which we don't understand, and we understand things only through old age elements. There are lots of diseases, problems, and let us try to understand out these elements, old age, both, and elements need lots of attention because the people grow old anyhow. They require attention from the teens, and if the people are suffering problems, certainly they should be paid attention. Anxiety, neurosis, depression, insomnia, anxiety, nervous disorders, nervous diseases, arteriosclerosis, cataract, osteoarthritis, menopausal syndrome are common conditions old age people suffer from. And today's topic we are dealing with prostatic is more common in men because you all know that it is a disease. So what are the common prostatic elements? Is not only BPH, other diseases where prostate gets affected, and those one by one. Was first is prostatitis, the inflammatory gland, and common causes. It is caused by either bacterial or viral. It usually happens due to diseases. Earlier it was very common, and also due to urinary tract infection, the prostate gets affected. Infection rises up to urinary bladder. In that condition, we have prostatitis, acute prostatitis. Chronic prostatitis is more mysterious because people get it on and off, and conventional medicine, the people prefer, not aware about homeopathy anymore, at least the area where I live in. They resort to which is actually not essential. With that, homeopathy is well worth trying before. Such treatment should only be attempted by experienced homeopath because you need to know more about prostatitis. This prostatic cancer is growing more and more. As you know that almost 80% of prostatic cancer occur in men over the age. After 60, this mostly this is in men, but not common up to 40 years also. If you see the rectal examination, what we call as per rectum examination, it can diagnose the prostate cancer if you are habitual PR examiner, because surgeons do that, and surface finger that can also diagnose this cancer. But there is a simple blood test where you can screen the level of protein. It's called as PSA. The level of the PSA, if it rises 10, it proves the, and further investigation, other blood states, even a biopsy done to verify whether there is a process. Over 40 should be screened for this cancer because grows in the initial period, and that is why if the screening is done in old age men. Economic factors in most people are bothered about these conditions, and qualified urologist usually handles because it is a, if you have to get rid of it, otherwise if the metastasis becomes very difficult to cancer, and cure becomes difficult. Homeopathy is in conjunction with this treatment, but if you try homeopathy to cure cancer. Lot of treat cancer of prostate. Appropriate is BPH, called as benign prostatic hypertrophy, benign prostatic hyperplasia. Okay, which affects the prostate in a such a way which leads to compression on the urethra, because the prostate around the urethra, will come to that, and it obstructs. The person will have problem with the urinate, and of frequent urge to urinate. The person has to go in the night to pass, and there is getting starting to urinate for a long time to urinate. Of stress, strain has to be given for the urine. It causes pain while passing, sometimes blood in urine, and the flow of the urine or the stream of the urine. Symptoms, if you get, you can think of BPH, and BPH is very common, more than in this side of in this the place where I live in. They suffer from BPH, and conventional treatment of BPH, for medication they get very low risk. So for every BPH case they refer such surgery, and even if the available in conventional therapy like still there is no benefit from that medicine. Resort to surgery, and one operation is known as transurethral resection. That is a common operation which they do, removal of the prostate, and removal of the prostate operative uh, becomes very problem. The surgery of old age will have lots of problems. So surgical problems you could consider those. The person should be treated by medicine. Homeopathy has got a role to play in the treatment of BPH, and that we will see through our seminar, webinar, or prior to that we should know what is maybe we know it, but we should know little more about prostate of this word, because I have come across many people who don't even pronounce the location of prostate is at such a place it cannot be seen, be felt from easily when you examine it physically. Little anatomy of prostate should be prostate. The shape of the prostate gland is pyramidal, walnut. If it has a little triangular space, walnut, golf ball is in that size. This has got a pyramidal shape, which is located at the base of urinary bladder, which is called as prostatic urethra. As the urinary bladder gets over, is located there around it. So easily compressing the urethra part of the urinary bladder. The prostate normally acid phosphatase, fibric acid, amylase, prostatic specific antigen, and this prostate makes a good bulk of the amino. There's a main constitutive bulk is concerned, where of the prostatic fluid come across. There is a prostate in male, there is a homologous organ in the female. males and females are homologous in nature. If there is something well developed in males and vice versa. So this is why in female there are glands of skinny, skinny. Those are homologous to prostate in men. Prostate is a male organ. Even though the prostate in females, most of them don't know about it very well. There is a function to that organ. If you see here in this diagram, it's a simple diagram. The image is you can see here this all urinary bladder, and this is neck of urinary bladder. This is a prostate, walnut shaped prostatic urethra, which can easily compress prostate. We can easily compress this prostatic obstruction if it gets enlarged. Here you can see I have taken a normal image of where you can see length, breadth of prostate. Normally it is 3 gram in weight, so small. 3, and length is only 3 centimeters, and it has got say 4 centimeter breadth and 2 centimeter width. So 3 by 2 centimeter its dimension, and that is why it's compared to most of the nuts and the smaller fig. Usually the fig looks like prostate. So let us have more about prostate through pictures. In a view of pelvis, abdomen and pelvis, because we are in the pelvic lower part of the abdomen. If you see from lateral view, you can see urinary bladder. Just you can see here a prostate having inside it seminal vesicle. So there is a seminal vesicle here. The vast difference plus urethra entering inside, and there is a prostatic urethra which commences further towards the pelvis. So this is the exact location of prostate. Just behind the prostate there is a vein. So if you want to go to pelvic, it becomes easy from here to examine prostate by digital examination. When you use a phone to examine prostate through rectal PR per rectal examination. Advanced urethral surgeries are also used to reach prostate. Here you can see a little more information. I have given you 2 words here. People pronounce with this word prostate, and the meaning totally gets your going towards prostate. So prostration becomes a rubric for homeopathic selection, but prostate is a correct pronunciation. So you have to draw from that. And plus, even though this is important and significant from the male point of view, most of the men are organ. They know testes, they know penis, they know urinary bladder, they know kidneys, vast idea about all, even lay persons. I'm talking about lay people. But this organ is so inside, deep inside pelvic organ. Front there is a pubic symphysis, both lower part of the pubic symphysis behind. So from front you can see this organ even if it is enlarged, and people don't know anything about it where it is located. But studies show that women know more about and even they know more about prostatic elements than men. You will have lots of coverage in the media. And the main function is production of lymphatic fluid, which contributes of the semen. And prostatic fluid or prostatic secretion, which is the spermatozoa, which are vesicles. When they come in the prostate and they get mixed fluid and the seminal fluid, that is for this purpose. Urethra form becoming infected also. Prevention plays major important role in male esteem. And the prostate can be examined by physician, even by homeopathy. How to do per rectal examination by putting in the rectum and slight uncomfortable to the person, cause little pain also when you enter, but it is very easy, easy for both physician and patient to diagnose. You can guess for the size, you can texture, consistency, and all that. Examination can reveal if the prostate enlarged or hard, consistency, if benign or malignant with the help of per rectal examination. Here there is to show you how this entered through the rectum, anus and rectum, and he's trying to palpate the. Uh, this is called as digital examination. In this image, you can see there are two images in this slide. You can see two prostates. One is abnormal, where it has increased large prostate. See, it is compressing the prostatic urethra, then of urine back to the bladder. And here, this you can see the normal. Here you can see the seminal vesicle duct is opening in the. Okay, and let us see one more image of normal prostate and the cancer. The previous in the the prostatic enlargement, that was mostly BPH, okay, benign prostatic hyperplasty. Here there is a picture of prostatic cancer because it has got a nodular appearance and it has compressed the urethra, and you can see the complete urine flow here. Becomes an emergency. And now, what are the encounter with enlarged? As we have discussed about the age, state is old age. Okay, but people also suffer from this disease. We are now going to deal more than with the cancer. Prostatitis will be carried through. Usually, prostate begins to increase, and it goes on increasing in day by day. Eventually, the person will, because there is increasing number of cells, that plasia. Hypertrophy, the gland becomes enlarged. Hyperplasia, and finally one and the same BPH. The condition is benign. Benign means non-malignant. Every enlargement doesn't lead. So the word been chosen, and therefore the name benign plasia is used simultaneously. As it continues to grow, there is on the urethra. Mainly, the prostate doesn't cause any local signs and symptoms, but because it causes pressure on the urethra, there becomes problem with the urination. Urinate properly as usual, and the bladder being a muscle, it compensates to some extent. Sometimes, say, a person starts getting hypertension of 40 years, by up to the after the 43, he may get that compensation increasing in size if the size fast. vigorously, becomes an emergency, the problems are mostly managed by in the initial period. But if it is left untreated, they continue to be a major problem, and the bladder may not be able to compensate men who are 60 plus and someone in 60 plus. What are the signs and symptoms of BPH? What are those 10 signs? What we is streaming urine begins to grow weak because men have got a penile. Men are very well. So stream goes weak, and that is the he will understand that something is wrong with his urination. That begins there. Speed of passing the urine also gets reduced. Okay, there is a feeling. There is a feeling or sensation when a person urinates that his is not emptied properly, and while initiating to pass the is very difficult. So he has to. There could be intermittent breaks. It stops, comes, and the person may feel the. So straining cause to push some urine and try to ensure the urine. And there could be dribbling of urine comes drop by drop after passing. There's the five main signs symptoms, and eventually the person will go to the again and again. There is a constant person has to walk in the night to the bathroom, urinate. While walking, urinate initially, inability to and inability to complete bladder. These all irritated and frustrated. This disease itself. He starts getting disturbed, and there could and the blood in the urine. See, in fact, blood in the urine accompanied by fever, chills, nausea, vomiting, great concern, and it's an emergency. Urine completely, no urine comes due to extra large prostate, and that is a severe condition. Now, how to diagnose? We have seen this previously about rectal exam. We can do an exam, digital rectal exam or PR, what we call. Then you can specific prostate increased level of this chemical pH. In addition, commonly used, but even ultrasonography of the abdomen and pelvis in the diagnosis, it will show you the size, exact size, length, 3 by 4 by how much it is increased in size. That from ultrasonographic examination, people do it. And conventional treatment, if you see, there are medications available which we saw earlier. Medicine doesn't help BPH, even prostatitis, and in conventional medicine surgery. So for little reasons, they will urologist, and urologist will take care of surgeries. And surgeries will lead to consequences in that person's life. So like crippling the person more, along with the old concerns. Uh, how manage this enlarged prostate has concern along with conventional treatment. What homeopathy can do that. Prior to that, what actually conventional steps to take manage benign prostate hypertension? Selective medication are used, but those drugs will reduce the level of male hormone that is called as. So that medications are more harm to the person. There are side effects. The main side effect is this: the level of reduced, and that is why a TUV is done, which is called as transurethral wave thermotherapy. Resort which this to treat black blockages to reduce urination, urgency, strain may help to some extent. Okay, or transurethral frequency needle ablation is called tuna is also done in the prostate tissues, resulting in an inflow. These are special methods which are used by medicine. Apart from that, hope to get rid of this enlarged prostate section. Even if there is a great size is big and you have to open abdomen, or sometime is also done monopolar or bipolar, which is called transurethral resection of, and enucleation is also done. But if you see all procedures, they are expensive and more or less they are cost. We have to take such patients to the urologist, urologified the people in the medicine. But these conditions care of rather this is what homeopathy ensures complete care for people. This is what we understand our experience in day-to-day practice. Homeopathy offers is, of course, we have nothing else than our remedies. So that is why of the today's webinar itself, homeopathic remedies in prostatic ailments. And the common prostatic ailment is BPH. More emphasis on BPH, benign prostatic hyperplasia. Primary remedies which comes to be prime are two of them: ambulata and persistence, and their indications I will try little trimedica. Remedies often helpful when the prostate is fast and the urine retention and frequent is there, which is common. But that a ball is lost in the feeling of having ball in the pelvic floor, pressure, swelling, and that are worse when sitting down. So the person down. Some of the people are sitting out plus this condition painful. Pulse of discomfort extend to the pelvis or into the bladder are worse when the man is lying back. This becomes characteristic for this. Also be a bland, thick, yellow discharge from the pulsatile is usually suited for emotional. There's a whipping tendency commonly that in a age with whipping tendency who want a lot of family members and relief in open air. Other are used for BPH are all of these significant. Apis mellifica, causticum, clematis, lycopodium, Staphysagra, Remedial Thuja, and one commonly uses Sabal. These are the common significant remedies. They come as a simillimum cases of typical. So in Mellifica, you all know there is a stinging pain while urinating, and the final drops are passing are worse. So that is a strong indication of may also involve the bladder. There may be cystitis and prostate condition. The prostate area is sensitive to touch. The person may feel worse aggravation from heat and from being warm rooms with improvement from being outside and from cool bathing. The person often passes urine sneezing and coughing. This is the main indication. Once the urine, the person may feel pressure or pulsation from the prostate to the bladder. This is a causticum is also indicated when sexual pleasure organism is diminished or it's lost. Clematis is for the prostate. When it is narrowed and tightened, the urine what you call constriction. Urine emerges very slowly, dry drop instead of stream. So the more enlarged prostate will produce signs and symptoms. Dribbling after the urination, you'll find in this case. Clematis is indicated with other consideration while referring of a case. Lipoclaim, this remedy is useful when the urine is slow to with pressure felt in the prostate and after urination. The with enlarged prostate may also pregnancy even in his 40s, 50s. And the people who need this remedy often suffer from digestive problems with lot of gas and bloating in the lower have energy to slump in the late afternoon, aggravation in the evening, 5 to 7 p.m. Matra Medica whole I couldn't get over here, but important Matra Medical to you. Then we have a specific here, Sabal cellulata. Hope you all know this remedy by now. Mostly it is not included in the syllabus of your UG or it is remedy list because for specifics are included. When urge to urinate in the night, the person has to walk in the night, bathroom and again for passing of urine. Difficulty in passing urine and feeling of coldness in the sexual and suggest this remedy. It is sometimes also used mostly this is used in and when there is an incontinence of urine in older remedies made up from soft, which is also used as a herbal extract for similar process. Herbalist, what herbalist about Sabal Cellulite, I will come to that. This mother tincture, I'll tell you why I use it. I really like this Sabal Cellulita. Emergency, at least it helps you. You can see here palmetto, what is called as. This is one kind of palm tree, Busi, and helps you a lot. Other indications for it. It is used to tincture form rather than in potency. Mother tincture is a specific treatment for if nothing helps to starts with a relief of BPH with the help of this. It is typically known as dwarf palm or soft. You saw that, so you saw the image of these remedies. When you select remedy through your realization, lots of symptoms when they closely match. You select remedy XYZ, Thuja, or Pulsitilla in a highest ranking, whatever for reputation selection of simillimum. following pattern. You can take one dose response. You have to explain this to the patient. Have some, patience to wait some time for these remedies to act. Improvement is seen. You can continue the remedy. Let the remedy work further. Improvement lags significant has already stopped. Another, the frequency of dosing, the condition, and the individuality. Sometimes a dose hourly or in a daily day, and one dose or less can be sufficient upon the remedy chosen and the condition of the patient. If with one remedy you get time, you have to select another remedy. You have, at any cost, prostatitis are really remedies. What I experienced through my last 20 practice, even though I teach human anatomy, I have a new time. I have my own. Right now, I'm sitting in clinic chamber. Mostly, I'm available chamber to patients by appointment. As usual, and minimum when I say get a remedy in a potency. If there is any problem with subcellular simultaneous, and this will avoid, the person has to stay with you, has to come to you. Most BPH patients, they directly go to the the family members they take because they try to get it operated, and you will by that time sabal cellular is at your hand, give instant relief to the patient, at least sabal cellular. Of BPH, when I diagnose as minimum initially given in the indicated remedy, few drops of subalcerate, like 4 drops, 8 hourly or 4 times in a day, for water considered for a considerable or for a week or for 2 weeks. I really try, and I have come across result with this. Uh, for a case of BPH, which I have received, 200 comes out to be an indicator. First 24 hours, I tried this remedy and drops of subalcerta 4 times a day for 2 weeks. Was absence of major complaint fortnight. Actually, this person was to get operated next day, and if I had not done that, that is the real only relying on the thing of subalcerta in such convinced, and if the patient convinced and he is ready to stay with you, there is no need of subalcerta. You can choose and you can take reviews to choose, and ultimately you will get that, because you see there is a good armor of remedies in your homeopathy. One or the other will certainly help you. So that is why a classical homeopathy here as an audience through YouTube later, they may not agree with the use of mother tincture. In routinely also they may not use all. Depends on patients they get. Okay, Sabal mother tincture is specific remedy for BPH. those who want to try it, you can try it. Bottle, you get it for more than 1,000 rupees. They're quite related compared to other mother tinctures. Homiopathy is an excellent and specific BPH. Herbalists to its inclusion in homeopathy knew it by name, and native have been using the berries of this like infection for many centuries. It had a good reputation as an aphrodisiac, but aphrodisiac effects are very less not visible. The early American, of whom many were knowledge of the they quickly included Savalsaleta in Materia Medica. This is some historical aspect of Savalsaleta, where clinical evidence made it most well-known homeopathic remedy for BP. Mother tincture instead of potency have rather beneficial in homeopaths may get good with various potencies also. The same Sabalsureta can be used in different potencies. Making diagnosis of BPH, I usually take patient in a classical way. My aim is to find seems the constitution of the patient, and I prescribe the remedy. And if I don't get Sabalsureta as a mother tincture, so in a may receive 3 doses of lycoprid, for example, see in first 24 hours, 8 drops of Sabalsureta mother 2 times a day. Such an approach is French homeopathic methodology is known as drainage. Classical homeopath may not agree. I don't fully agree with this. I don't use, but for Sabalsureta and BPH, one of the homeopathic remedies I prescribe in this way. To the last slide of this PowerPoint presentation. You're watching one person, aged person, than my father. He's my father, and he has BPH. He has BPH because living and is 94 now. 15 years back, he celebrated 90th birth anniversary to 94. Okay, so after function regarding his health, the therapy of homeopathy, my other brothers wanted to take him to urologist for immediate operation. 15 years back, I'm talking 15, more than 15 years back, after the age of 70. And at that time, explained all of them to resort to his. So they agreed to that. Now he's 94. I have thuja for him. He is giving testimony about that success. That is why I have chosen this picture. That he says he finds difficulty in urination. He calls me to give those drops. He doesn't know he gives those drops to me. And now he's 94. Look at his face when he was 91 years back. So this is what you get. I have showed a picture from my own family to give a testimony about homeopathy as well as about Sabalsureta. And I aim today's webinar. Karthik told me to choose a small topic. So I chose a small topic. This is my first introduction to I love homeopathy, and I really appreciate the work of Mr. Karthik. Is my Facebook friend, and he came to know me through thing, and he once asked me to join his team, and so I immediately agreed to join him. Otherwise, I take daily seminars on Zoom students, and very occasionally I take seminars on subjects, including homeopathy and homeopathic medicines, which I see in my clinic. I thank you. I hand over now microphone to Mr. Karthik. Thanks a lot.
Thank you, Dr. Rosario. It was a impressive one, and we learned all the remedies that are generally used for this condition. Uh, does anybody in the audience like to ask anything to Dr. Rosario? Any doubts that they have that they'd like to ask? Any other tips that they have, or if they have a case they'd like to discuss with Dr. Rosario? He's here. You can type out in the chat box, and Dr. Rosario can see it, and he will answer you. Oh, thank you, Kimberly. Well, this must be what, 11 o'clock there at Detroit? Calcification, doctor. Doctor, there are a few chat messages.
Yes.
Aya Ibrahim wants to know about calcification, doctor.
Actually, I try to explain people can be used for prostatic ailments. There are a lot which are used by the conventional system. We call yeah, the cancer and calcification. Now to go through this PowerPoint presentation, conditions of severe calcification and you require more constitutional. I told you lots of experience you achieve that remedy for the purpose of treating calcification of cancer by homeopathy. Somewhat TURP. These are the procedures which are used by urologists instead of prostate for to some extent. Even the receipt will have gaps. There are patients coming to us after getting for prostate. After prostate also, also they don't get full. They again come and try to medications. And when they come to know that there are homeopathic remedies, that is if you are not able treat a patient through simile, I recommend you to use subject.
Doctor, there was Edel Bolger who asked about TURP, post-up
So
incontinence.
homeopathy, what are the measures to treat ailments that I am that through the PowerPoint presentation because we considered those also. And this is so
Doctor, the other thing is, Doctor
That's what
Rufino would like
happens.
to.
Urethral resection of prostate is done by the urologist, and they get relief to some extent, relapse for incontinence. I recommend to use first homeopathy, including the subalcel. That would be the last resort. URP is the last resort.
Doctor, what about infection?
Infection.
Yes, does infection play a
Yes,
part?
infection. Rufina wants to know what about infection. I talked about infections. When there is a bacterial or viral infection, the conventional treatment is, of course, antibiotics. The infection I'm talking about, same thing, leads to prostatitis. In case of prostatitis on like stinging, burning sensation and all that, the remedy works beautifully. The person's history, if it to ephismilic mica as a simillimum, certainly give relief. So they not take antibiotic. There are other supplementary measures like lots of water and cleanliness and all that. Homeopathic remedy prostatitis can also added, because these remedies are stimulant and immunity to fight against the infection. Philosophically, I'm telling you, you don't need antibiotics. Yes, sir.
Somebody else has asked. Thank you. So, does anybody else have anything to ask, Dr. Rosario?
I think, Mr. Karthik, some of my students today's webinar, I
Ah,
asked them, but I don't see more clinical students, you can call them. The final year.
right.
Somebody knew the cancer 100%. Removing the prostatic cancer 100% homeopathy, I talked about that. Homeopathic simultaneously used with the modern medicine. To treat cancer, you require experience. You have to handle such kind of which I have never had prostate cancer. That is the reason I focus more on prostatitis and benign prostate hyperplasia. For cancer, there are remedies too, along with the conventional treatment.
How about recurring? What if it recurs, doctor? How would you treat that?
Question and answers are over now.
Uh, Rufino just wants to know what about recurring conditions?
How about chronic recurring prostatitis itself is chronic prostatitis, and chronic prostatitis can be get ready get recurring condition chronic prostatitis or chronic prostatitis, what you call. About that also, those can be treated with homeopathic traditional remedy. We need to take a constitution based on case history by we can get rid of chronic prostatitis. I have seen a lot of homeopathic remedies in chronic prostatitis, acute prostatitis, chronic prostatitis, of not extra large. They are all rich of homeopathy and very easy to say. Except cancer classification, not tried, but some homeopath also. Those who have cured such cases, they will speak more on that.
Okay, I think
Yes, Mr.
with this, I think everybody's done with the questions. I'd like to thank Dr. Rosario for sharing his knowledge with all of us. I'd also like to thank all the participants who have come here and joined us for this. Marilyn from Canada. What would you like to say? A few words, Marilyn? I've switched on your webcam and your mic. Would you like to give us a feedback? Would any of you like to give us a feedback on
Yeah.
what you just learned now? So, and for all of you here,
Or if anybody has used homeopathy for experiences.
no, I don't hear you, Marilyn. I've got your mic on and your camera on. Yeah, if anybody has experience, it'll be nice. You can share it. So, if there's very interesting. Thank you, Edel. Have you had any experience with homeopathic remedies for this condition? Okay, no problem, Marilyn. We'll get you on the next time on a webinar, not to give us feedback. All right, doctor. I thank you once again, and also thank you all the participants once again, and hope to see you next Saturday. Next Saturday is a very interesting seminar on the management of ADHD with homeopathy. The link will be up maybe in a few hours on the website and on Facebook. Uh, we'd like you all to come and join us in this seminar. All right then. Bye. Bye from I Love Homeopathy. Thank you, Dr. Rosario, and bye everybody.